concerned about one of her classmates who was seeing a doctor and getting a medicine, and that might be a gateway. I may be overreading that, but the CDC does say in certain communities, certain populations, over half the heroin users did start with prescription medications, either prescribed for them or diverted to them from a friend. In fact, believe it or not, being a varsity athlete is a risk factor, ultimately. Getting hurt, getting a narcotic, your pain, and then becoming addicted to it. So the medical community is definitely responding aggressively. The Hampshire Medical Society is aggressively educating its members. But going back to your question, near the turn of this, back in around 2000, there was a big push to make sure that physicians, the healthcare communities, eradicating patients' pain. In fact, it became the fifth vital sign, in addition to blood pressure, temperature, pulse, breathing rate. Fifth vital sign was pain. How's your pain? In fact, it is so important, or it was pushed so heavily, that many of us in the audience probably have received surveys after they were in the hospital. 3 questions asking, how was your pain addressed? Were you given pain medication? Was your pain adequately treated? Not only is it something that we're incentivized because we're told to do it, but CMS is withholding payments if your survey scores aren't good enough. And part of your scores pertain to eradicating pain. So that's the pressure, and that's the environment under which we've been practicing medicine. But fortunately, things are changing. In fact, you may have heard the president this week in West Virginia talk about addressing these perverse incentives. We're highly motivated to eradicate pain, but we're trying to cut down on the use of narcotics. The United States consumes far more than half of the world's supply of narcotics right now. So something has to change.
Okay.
Just Dr. Combe, I know you touched on this a moment ago. Are we in the search for an answer and a reason for all this? You believe we're overemphasizing, though, the prescribing practices and the importance of it? You said it's not just about the pills.
It's not. It's multifactorial by a couple of different things. So the fifth vital sign is a perplexing circumstance that certainly was one of the genesises. And pain is not a vital sign. You don't measure it like the other circumstances, the pulse and heart rate, pulse rather, and blood pressure. So that was very contrived. And going back to the numbers, I think it's important to break out what 50% is. Who makes up the 50%? And if you really want to have measurable results that you can track and show that your efforts are directed in a timely way and an effective way, is to break out the 50%. Who's responsible for the 50% of those folks being attached to prescriptive opiates? A blanket approach, you think you're going to get everybody. I think that in my research and reading and becoming much more aware of more of the details, people again find ways around legislation to prescribe in atypical fashions. And when they find out that there's reimbursement attached to it, particularly when an industry's already been created and is well into a decade and a half of a professional direction attached to prescribing narcotics or opiates.
Yeah, fine line to walk. All right, we're going to pick up this discussion.